As we wrap up Suicide Prevention Awareness Month, we continue to break down the issues and resources available to reduce the number of suicides here in our state. According to the CDC, suicide and homicide rates for children and young adults between 10 and 24 in the U.S. are the highest they've been in decades. So in this week's Mental Health Moment, we're here to discuss the underlying issues and resources available to Maine youth. We have Dr. Mark Kaplan, Sweetzer's Medical Director. Thank you so much for being here. So Mark, why do you think these numbers are so high for youth suicide?
Sure, and first of all, thank you so much for having me. What we believe happened with the pandemic, or during the pandemic and the immediate aftermath, there was such a huge increase in anxiety and depression. And the kids were in a tough spot because their classmates, their friends, they were all going through this together, but they were all very isolated. So they couldn't really, see each other at school and lift each other's spirits up. They were just left in, their room to do their schoolwork and then look at social media where everyone else looks like they're having a better time, And compounding that, justifiably, their parents were very stressed. Parents were losing jobs. Parents were, all kinds of things were happening. Parents were ill. Grandparents were dying. So it was a compounded, very significant psychological assault, the pandemic.
Yeah, and so, we had talked about this a little bit the last time, but if you see what are some of the certain, behaviors, or what can we look out for if we think somebody is having a difficult time?
Yeah, so I'll focus now more on an adolescent because they can sometimes present a little bit differently than an adult with depression. But some of the similar things, an adolescent is the first thing is going to happen is they're going to stop wanting to do the things that they enjoy doing, or they're going to focus very heavily just on the things they enjoy doing. Because as the depression starts to creep in, their mind is always filled with very dysphoric thoughts. I'm no good, I suck, no, my friends hate me, my girlfriend's gonna leave me, I'm gonna fail that test. Those thoughts just become pervasive and very invading, So if they just lay down at night to try to go to sleep, they're flooded with that stuff. So they're gonna stay up all night and try to play video games, something. Then they don't want to go to school in the morning. Their hygiene's going to not do well. They're going to socially isolate a lot. If you start to hear them talking about, who needs me? The world would be better off if I was not alive. Then you really got to worry, and then you got to ask them. You're not going to put ideas in their head. You got to say, Sarah, Joe, are you feeling like you're going to kill yourself? And because we can help you.
And I'm going to bounce around a little bit here, but we want to talk a little bit about firearms in the households and what parents can do, what families can do to help keep kids safe or adolescents safe, really anyone safe from that.
Yeah, so there should never ever be an injury or suicide from a child using a gun. Never should be that, okay? And if there is that situation, it's because a parent accidentally left a firearm not secured, right? And it happens, but it's really unacceptable, right? And children will kill themselves intentionally with firearms. Sometimes there's unintentional deaths due to a kid playing with a gun. So, among other things, the Maine Gun Safety Coalition has arranged, you can get anywhere in Maine a free gun lock. It's a chain gun lock. It's applied easily to the gun to secure the trigger, and you can rest confidently knowing that your grandkid or your neighbor's kid or your kid is not going to come into the house and get access to that.
Yeah. Well, quickly before we wrap up, because we're running out of time, I just want to give you a moment to say if there's somebody out there who needs help, where are the resources, how can they get them?
Sure. So there is a national crisis hotline phone number. You can call that number right in Maine. It's on the screen. And depending on which part of the state you live in, one of the local trauma or crisis teams will come and work with you. If you're very concerned, you can bring your loved one to the emergency department for an evaluation. So we have access. We just you just got to recognize the warning signs and give us a call for help.
Dr. Kaplan, thank you so much for joining us. Such an important topic. We really appreciate you coming on the show.
Thank you so much.
Thanks so much.